My name is Pat Lillis. I am a dentist in Overland Park, Kansas. I started my journey through dentistry really started when I was 13 years old and I was in the laboratory with my grandfather waxing and casting gold inlays. And from there, I really never wavered. I went to college and then to dental school, and I knew I wanted to do dentistry right away. Again, I was a teenager. What led me to so much into full arch was truly my residency program. So I did a multi-year advanced education general dentistry residency. And during my residency, we were really focusing on the full arch patient. A lot of our patients that were rotating through our clinic were all full arch. And so back in those days, we were trying to figure out how we could pioneer a system to get those patients to get out of the denture world and into something that they could wear that didn't come in and out of their mouth, and something that we could turn around pretty quickly. So that journey is pretty wild when I look back on it, especially today when we have so many materials at our disposal and so many different techniques at our disposal and so much technology at our disposal. But we were taking patients and turning systems around within 48 hours. Back then, we thought that was revolutionary. And that was really truthfully where we started, is how do we take these patients? And patients just fell on our laps. We weren't really seeking these out. It's just that the school was feeling that they needed to refer those patients in and that we were the ones that could treat those patients. And so that's really where we really started to do full arch. And I was really kind of honed in. I found the process very, very fascinating. I thought it was incredibly fascinating to take patients from taking no teeth to wearing teeth that they can walk out of our clinic within about 48 hours. So I look back on what we used to do, where we would do everything in the analog world. We would make a denture setup. We would take that analog setup and transition patients, to wearing teeth the next day, basically using our denture, and we would cut it back. And we did that for years and years and years with a lot of success. And it wasn't until several years ago that my laboratory technician, and this is why I love surrounding yourself with mentors and friends. My laboratory technician came to me and said, "Hey, I really want you to introduce you into doing digital full arch instead of doing analog full arch." And I said, "Sure, I'll try it." And so I said, "But it better work like it works with analog." And not only did it work just as good, but it worked better. So our systems are much more efficient. We're able then to use whatever laboratory we want. So my laboratory happens to be in Los Angeles. So we're able to communicate with them in real time, taking a patient from teeth to no teeth to same day teeth that we can screw in. And we can do that working with a technician in Los Angeles. So that's part one. And then part two is when we go to make the finals, we are able to take the patient, what used to take maybe 10 appointments or 11 appointments or 12 appointments, down into 2 to 3 appointments. So we used to take several hours of chair time. Now it takes us a fraction of the chair time. So it's not only easier for us, it's way more efficient, it's way more predictable, but also from a patient standpoint, because some of these people come from a ways away, that helps them not have as many visits in the office. And so it's truly revolutionized how we're doing. But what makes study clubs so powerful to learn and grow together has been just that dentists can come to their local environment along with their specialist, and they can all get together and they can share ideas, they can share information, they can share the wins, they can share the losses, they can share the pros, they can share the cons. So it's truly a format where dentists can grow together and get better and to share information. One thing I like about the RISE Institute is that while we in the Seattle Study Club are able to go to different venues to lecture, we're only lecturing to that study club and their members. Whereas at RISE, we have the opportunity to lecture to multiple different clubs. And then also those clubs can bring their referrals to RISE to learn together and interact with different clubs that they may or may not know. So it's really like a little mini symposium that we get to bring to each geographical area, and each person can come. And now our reach is going to be so much bigger than it was when we were doing traditional study clubs. I think in today's world, we as dentists we always were on islands. We'd sit in our practices for the majority of ourselves by ourselves, and we would maybe have a friend or a colleague that we'd reach out to. In today's world now, so with social media, a lot of younger clinicians are going to social media and trying to pull out different types from social media. I think the powerful thing about a study club is that you can meet with each other instead of one or two people that you may not even know on social media or different different avenues through that. And you can sit down with a person in your community and you can share those stories. Because what may be one thing for me in Kansas City may be completely different in Los Angeles or Boston or New York. And so you're there geographically with your own peers and sharing information with your peers in your local community, not just one or two, but maybe a study club of 25 or 30, and with different specialists that are there to help, and everybody's there to grow together. I think that is really the powerful of a local study club, but also the relationships that are built. It's not just one thing to talk about dentistry and to share dentistry and do that, but the local relationships that you would have for decades in your community that you're able to foster and that you're able to grow together. And then you do things socially outside of dentistry. That's what truly makes study clubs special. The RISE Institute was really hatched to bring more content to more clubs. So when RISE concept was introduced, the thought was that instead of taking some of our Seattle Study Club speakers and going to one venue, we can now, multiple clubs can bring their referrals to the RISE Institute, and we can just reach more people. It's a brilliant idea. So instead of Pat Lillis coming to a certain demographic and going and speaking to like one director and their study club, now different study clubs can come to the RISE and they can interact with that speaker outside of just one-on-one. From a cost perspective, it's even better. So instead of having us come to their area and flying us out and paying honorariums and travel, with RISE, they can literally come and they get us in the same venue and the same exposure, and they can all then just get more exposure to more Seattle Study Club speakers instead of just doing one-on-one. Yeah, so when the RISE Institute was set up, it gives the ability to have different, it has different speakers with different topics. So you can choose which topic that you want to come to. So if you want to come to demystifying the full arch, you can come to our lecture. If you want to go to a different lecture done by another Seattle Study Club speaker, you can do that as well. So it gives you the opportunity to pick and choose kind of a la carte basically on what you want to choose and where you want to go. And then you get access to that speaker versus having that speaker come in one-on-one with your club. Basically, when we look at a digital dentistry, I am all about implementation. So 90% of my life is spent in my private practice. So every single thing that I lecture on is something I use in my practice. So if I don't use it in my practice, then I'm not going to speak on it. And it better meet a certain amount of criteria. And that criteria is it better make me more efficient, more predictable, and actually more profitable. And those are the things that we discuss when we talk about digital dentistry. We don't discuss it because it's very cool and it's really hip and it's the new technology. We discuss it because it's making us way more efficient and way more predictable. That enhances not only my life, but it also enhances our patients' lives with lesser appointments, easier way through those appointments. And it's just overall a better experience and a better experience for the patient. So when people always ask me, like when I speak about digital dentistry and why I'm so passionate about it, I'm passionate about it because it's allowed me to work less. It's allowed me to work one day less a week and still get to where we were when we were doing analogs. So every single thing I lecture on is every single thing I use in my practice. And so I'm big on implementation and practicality also. Doesn't do me any good to bring in technology if it's not practical, if it's hard to use, if it's something that is cumbersome to my team. That doesn't do me any good. So literally every single thing that we talk about, I use in my practice, not only for a few times, but day to day, hour by hour, minute by minute basis. You know, full arch has become, like when we look at where we started with full arch, we go back to our dentistry days as far as removable dentistry. We made dentures basically. Analog picked them up, cut them back, put them in the patient's mouth, usually the same day or the next day. Full arch has been, and even that technique, there was variations of that technique. I think looking at different techniques for full arch is important because each clinician is going to have something different that works best in their hands. So what works best in my hands for one clinician may work differently for another clinician. Also logistics. Is your surgeon, the surgeon that you're working with and your restorative dentist that you're working with, are you in the same facility? Are you cross town? Are you cross state? So the ability to look at different approaches is important because each person's differently and each setup is different. Also, from a price standpoint, some people, we look at it, each one of these different systems has a different price point. So what may work well in our hands with our fees may work differently with another system with a different fees. And so I think it's good to look at different systems because what works well in my hands may work something completely different in somebody else's hands. What I'm so excited about with our facility in Denver is going to be easiness. It's right next to the airport. You can fly in, you can go to the institute, and you can be right there. So just from an ease of standpoint, that's one of the things I'm excited about. Second, it's a world-class facility. When you walk into a world-class facility, it changes the total dynamic of learning. We have more cameras, we have more AV at our disposal, and we're able to show more and share more in more of an intimate setting than we would be had it be something that is lesser facility. So I'm so excited with the technology that's involved, the AV system, the sound, the cameras, the amount of TVs that are around. Just the really overall facility is world-class, and we can't wait to share the information with you in this world-class facility. Well, with Seattle Study Club, we're very blessed to be around educators that are one of the experts in our area. And the interaction that we have with each other is really, truly special. And what makes Seattle Study Club special is not that we have experts, yes, we do, but the relationships that are involved with the different members and the different ways that we can interact with our teams. And what makes it special is that the people that are going to be coming through Denver at the Vivos Institute are going to be world-class speakers, but they're all world-class people. I think that's what separates Seattle Study Club really from other institutions, is really not only the expertise that all of the speakers bring, but also the camaraderie, the compassion, the warmth, and just the willing to share all that, because we've all been through dentistry, for us, some longer than others. And so we all have stories to share, and we really just want to truly leave the little campfire better than we found it. Yeah, this is a really good topic as far as intimidation. And when I talk to surgeons that I work with in my community, that's the first thing they say, is that I really want to do more. I want to do more full arch cases, but my referring dentists just feel intimidated by it. And I tell them, if we can teach them predictable tools like anatomical landmarks or where to put the teeth, we can give them some cues on what to look for and make that a little less intimidating, but also show them the steps. Step 1, step 2, step 3, step 4. This is what you look out for here. We can give them a really kind of a cookbook. This case has become less intimidating. And we harken back to just the rules of fixed and removable prosthodontics. And that's what I teach, is that I go back and say, these are what you were taught your second year in dental school. The rules are still the same. Now the technology and how we capture the data and how we manipulate the data and the materials is different, but the fundamentals are still the same. So we go back to just those fundamentals. We teach the fundamentals first, and then we start layering on piece by piece the technology and how we implement the technology, how we interpret the data, and how we use that data. That is truly where we start to simplifying the complex, because it can be intimidating when you're looking at these cases, and not all of us were lucky enough to do a residency program after dental school. And so we're cognizant of that, but our job is to really take it, what would be very complex, and take it into bite-sized pieces, no pun intended, to make it to where it's doable, not only for the surgeon, but also for the referring dentist and the whole entire dental team. Team is everything. So one of the things we teach in our course is it doesn't do me any good to buy all of this technology, put it in my office, and just say, okay, let's go. It's not that simple. In fact, that's where I think a lot of things go south and a lot of frustrations happen with dentists, but also team members. When we buy technology and we implement the technology in the practice, we have to have the dentist be the leader and explain the why behind what we're doing. So if I'm bringing in, let's say, an intraoral scanner or even photogrammetry, I have to tell the team, hey, this is why we're doing what we're doing. Then I can get the team to buy in more. I also have to then tell the team, hey, this is really important, and it's going to not only make our lives better, but it's also going to make our patients' lives better. That's important too. So you have to get the team on board, because truthfully, it doesn't matter really at the end of the day what I want to do. If I can't get the team on board, then it's going to be constantly trying to push a boulder up the hill. And so team is everything. For technology, team is it. We have to have the team on board. They have to know the why first, and then we'll do the how and the what. You know, it's interesting. When I used to do full arch, it used to be probably one of the most tedious things that we would do in the office. And we did that because honestly, in our community, we and several others were kind of it as far as what we were the go-to people to do full arch. And so what we want to do now with digital is open the aperture more and have dentists do more. And so by our course, hopefully what will happen is a transformation of the person when they first come to the course, and when they leave, we want them in two different spots. And so what we want to do is be able to take a very complex, somewhat advanced topic, make it so that it's not so intimidating, give them steps, give them tools to work with so they can bring it back to their practices. Because what used to be a very labor-intensive process has now become a very efficient, a very predictable, and a very profitable model. And so we'd like to share that technology and how we're doing that on a day-to-day basis.